know who you are, but I will find you and I will contaminate all your instruments.
The first step in transporting instruments is have on clinical attire, surgical gown, protective eyewear, and utility gloves and a mask. You will place contaminated instruments back into cassette. Any loose instruments will be placed on top of closed cassette and then will be wrapped in the used blue paper. Walk to sterilization room without touching anything. Bring in on contaminated side. Put any extra instruments in blue, put the plug. When opening the instrument washer, you will put the plug into the instrument washer. Your instrument put in blue cassette. Turn on washer. Allow tub to fill and get hot. When washer stops filling up, you will hear a click. Then you will hit the start button. Cycle will last for 3 minutes. Continue to wear your utility gloves when you are getting the instrument out of washer. Retrieve a blue towel to dry off instruments. Continue to pat down the cassette until it is dry. Once cassette is finished drying, you will wash your utility gloves with antimicrobial soap. You will dry gloves with paper towels. Remove gloves. Wash hands before donning on exam gloves. Move cassette to the blue paper. Open cassette. And put in the mechanical strip inside. Securely close cassette again. Place cassette into autoclave. Ensure autoclave is closed. Press PAX button and then press start. In order to drain autoclave, you will pull tube attached to autoclave and drain water into bucket. The Statum is used for a flash sterilization cycle. Always sterilize XCP and Statum. Before inserting XCP, check levels. If needed, add distilled water. The dirty water will go into the waste reservoir. You will insert the XCP into Statum. You will close lever, put into lip, insert until you hear a click. To ensure it's closed, press pouch button, and then press the start button. Lisa, place handpiece inner burrs paper side up. You will turn on and follow directions on screen. If water is needed, you can find the tank on top of the Lisa. If draining is needed, use hose, which can be found on top of Lisa, and then drain water into bucket. For testing. This is important in order to make sure all sterilizers are working properly. You will need an incubator and a notebook to record date and time. There are vials labeled for the autoclave, Lisa, Statum, and a control vial. You will place vials in paper pill pouch, run vial through each sterilizer. We'll then crush vials and then place vials into the incubator for 24 hours. The results indicate that sterilizers are sterilizing properly. If you receive a purple reading, it is meaning that it is negative and that the sterilizer is killing the spores and there are no spores present. A yellow reading is a positive result, meaning there are spores present. You will record results in notebook and dispose of vials in Sharps container. At the end of clinic day, you will pull the plug in the instrument dishwasher, lay in tray. You will then close dishwasher. You will hold the drain button until you hear a swoosh. Then you will leave open the instrument dishwasher.